we have connection between untreated periodontal disease with preterm labor, low birth weight, preeclampsia. So how many women actually know that there is a big link between untreated periodontal disease and fetal abnormalities?
This podcast is meant to provide information on reproductive health. It does not establish a physician patient relationship, and we would urge you to contact your treating provider regarding your care.
Hi, it's Noorhasan. We're back at the Modern Parenthood podcast. And today I'm delighted to have Dr. Naira Kraipak to talk to us about oral hygiene as it relates to fertility as well as pregnancy. Dr. Kraipak, welcome to the show.
Thank you. I'm excited to be here today.
Well, first of all, tell us a little bit about yourself.
Well, I am a general dentist and have been practicing for about 15 years now. I graduated from University of Pacific, Dagoni School of Dentistry in San Francisco in 2011 and moved to this wonderful city, which now I call home, and have been practicing dentistry since then. 8 years ago, I transitioned to private practice, and my office is called Plush Dentistry in Frisco, and it is a hybrid practice where we do cosmetic dentistry as well as family dentistry. My husband, who's also a dentist, he takes care of the cosmetic aspect, and I do more of family dentistry where I see all age groups and especially women in those reproductive years, which we're going to be focusing on today, and I'm looking forward to our discussion.
Fantastic. Well, I love to start off the show with a patient example. So let's have a patient example. Let's call her Amelia. She's 30 years of age, and she has been trying to get pregnant. For the last week or so, she's noticed that she's had some toothache. And so she's thinking, should I go to the dentist or will this go away? Will it affect my ability to get pregnant? Well, what if I am pregnant and I need this to be taken care of? How does my oral health affect my pregnancy? So we're going to be answering all those questions today.
Yes, of course.
And the first thing I'm going to ask you is, can you tell us, just kind of define for our listeners, what is the oral facial complex?
Well, the orofacial complex is not just the mouth and the teeth, but the entire face. It's supporting musculature, ligaments, blood supply, nerves. And so over the course of years, dentistry has, kind of moved from focusing on just the health of teeth and gums to kind of establishing a connection of this orofacial complex with the rest of the body and what actually can happen in the rest of the body if you don't take care of your mouth. And so it's a really important discussion, and it's very important to understand that our body is one system, and we, especially as healthcare providers, know that if one system is infected or inflamed, it can definitely infect other areas of our body, and that's why this discussion is so important.
You touched on something super important just now, and I see this in so many different aspects of medicine. But when one system is inflamed or infected or not working right or has a chronic medical problem associated with that one system, we get that domino effect where other parts of the body start to fail or they're not working as well as they should. So I'm so delighted to talk about the oral system and how it affects the rest of the body. Tell us a little bit about oral dysbiosis.
So dysbiosis is any imbalance in any part of the body. It happens in the gut. Similarly, it happens in the mouth. Just like the gut, the mouth also has good bacteria, and then you have disease-causing bacteria. And anytime there is an imbalance between the two, your health does get affected. And this imbalance can happen because of a wide variety of reasons, pregnancy being one of them, fertility treatments being one of them. And so once this balance is affected, it definitely impacts the mouth, the teeth, bacterial overgrowth can then permeate into the bloodstream, causing bacteremia, and then a host of other things that can happen in the rest of your body.
Yes, it's so important that for us to understand how the oral system really affects the rest of the body. We're going to talk about one more thing before we talk about the theories behind of how this works. Periodontitis. Tell us a little bit about that.
So periodontitis is essentially the disease of the periodontium. Periodontium involves the supporting structures of a tooth. So a tooth is inside of the bone and it is actually supported by the periodontium, which includes the gum tissue, the bone, the supporting ligaments, the vascular things that are there. And so any infection or inflammation of this periodontium is called periodontitis. It can have various stages. It could be mild, mild to moderate, moderate, and then severe. And there are enough established evidences that untreated periodontal disease can cause a host of other systemic problems. There are so many evidences now linking periodontal disease, uncontrolled periodontal disease, or untreated periodontal disease to, for example, cardiovascular disorders. A lot of the bacteria that are present in advanced periodontal disease are also present in infected cardiac valves. And so when you go for your cardiac screening, you will often see in the questionnaire that, you're being asked when was your last dental cleaning and last dental checkup, because there are established, there are researchers out there that do link the two. And so this is just one example. There are a host of other diseases which could get exacerbated if you have untreated conditions in your mouth, for example, periodontitis.
And you're right. When someone who has cardiac disease or cardiac valve disease, when that person goes to the dentist, typically that person has to be placed on antibiotics just for something as simple as cleaning, because anything that's dislodged from the oral cavity can affect someone with valvular disease of the cardiac system. And you're absolutely right that the diseases of, or the dysbiosis of the oral system can be dislodged and go to any other parts of the body. And the same thing too, we see it with gut dysbiosis, even vaginal flora dysbiosis, where there's an imbalance between what's a normal and abnormal bacteria. And then those things affect pregnancy and other aspects of fertility. So this is amazing that we're talking about oral dysbiosis and periodontitis.
Yes, absolutely. Coming back to like cardiovascular disorders, especially if you've had recent surgeries in the last 6 months, you more than likely you will be required to take a dosage of antibiotics before your cleaning as well, because again, those bacteria can go into your bloodstream, causing bacteremia and exacerbating conditions. So yeah, definitely, these connections are well established and very important to discuss.
Yes, and it's also not just the bacteria going into the bloodstream to other parts of the body. There is also an inflammatory component as well that we see with this oral dysbiosis. We're seeing elevation of inflammatory markers like the interleukins 1 and 6, the tumor necrosis alpha, and many others of these inflammatory markers.
Definitely, and that these inflammatory markers can exacerbate certain existing fertility conditions, for example, endometriosis. These can also pass the placental barrier sometimes. Bacteria can do the same and cause fetal toxicity. That is why we have conditions like chorioamnionitis sometimes happen. We have connection between untreated periodontal disease with preterm labor, low birth weight, preeclampsia. So how many women actually know that there is a big link between untreated periodontal disease and fetal abnormalities? Or their chances of getting pregnant could be compromised because of an untreated disease in their mouth.
You're absolutely correct. So bacteria that's dislodged and goes to what we call the chorion and amnion, the two layers of the sac containing where the fetus grows. If that becomes inflamed, that's you would need antibiotics to treat that, but also it can lead to preterm labor, having a baby born early or prematurely. But just like you said, those inflammatory markers going as well to the placenta can inhibit the function of the placenta, and therefore the placenta does not supply the growing fetus as it should. And we can get things like intrauterine growth restriction. So there are many aspects of where the oral health can really have an impact on pregnancy.
Absolutely.
And then as it relates to fertility, I read that women with abnormal oral or with oral dysbiosis, they can have a longer time to conceive, 2 or more months longer when compared to a woman of equivalent age, equivalent demographics. Just having the oral dysbiosis can affect her fertility.
Definitely. I think there were a bunch of studies that were done between 2013 and 2017. Some of them looked at pregnancy outcomes in patients with active periodontal disease versus somebody who doesn't have active periodontal disease. And you're right, a lot of those studies established that these women were anywhere late by 2 to 12 months. They took longer in getting pregnant than somebody who did not have active periodontal disease. Same with IVF treatments. There was a study done where they looked at factors such as successful egg retrievals and successful embryo for implantation, and there was a direct correlation between people who had active periodontal disease and those who did not. And so that kind of, again, reiterates the importance of seeking preventive dental care, whether you're pregnant or you're planning on being pregnant, or you're, going to go through IVF treatments. Another very important thing to remember is, especially during fertility treatments, you might be on hormone therapy, you might be on additional drugs, immunosuppressants. So all of these also affect in the way your gums are now going to react to the oral environment. Hormone therapy, for example, our gums have hormone receptors, and so when these hormonal spikes happen, especially in pregnancy or when you're undergoing fertility treatments, your gums are now going to be more sensitive to any plaque or buildup in your mouth. That's why we see more women complaining of gum sensitivity or bleeding gums, even to chewing food. And so what happens is these receptors then make the blood vessels very permeable, which means any bacterial growth can now have access to your blood vessels, get into your bloodstream and cause bacteremia, and then a host of these things that we just spoke about. So a lot of drugs also during pregnancy can cause a drop in saliva. Any drop in saliva is going to also lower the pH in your mouth. And what happens when the pH of your mouth is low? Bacteria can thrive and multiply. And so you again have an increased chance of having periodontal disease or cavities that can again lead to the host of things that we just discussed about. You may have heard a lot of women complain that I hear that all the time, that I did not have cavities or anything wrong in my mouth until I started to have children. And in a way, it's true, because hormonal changes do cause gum changes and do cause changes in your mouth. And even though pregnancy is not a disease, it's an altered physiological condition, but hormonal changes do affect your mouth and can worsen existing disease.
You're absolutely right. When we see pregnant women, we always tell them they are more immunocompromised compared to their non-pregnant state. They're more predisposed to getting infections than had they not been pregnant. And a lot of that has to do with the elevated estrogen levels or the elevated hormonal levels you see in pregnancy. And so pregnancy is kind of the highest hormonal state a woman can achieve. And that's why we're seeing things affected like the gums, and they're more predisposed to gum disease as well, in addition to all the other diseases while pregnant. And you're right, when we give patients injections for IVF, that raises their estrogen levels, it increases their hormone levels, also predisposing them to the gum disease.
Yes, yes, definitely. And we see that all the time. I mean, our pregnant patients, the most common things that we see, whether they're going through fertility treatments or natural conception, the most common finding is bleeding gums. And so, again, that is a hyperreactive response of the gum tissue to these hormonal changes that are occurring in their mouth and in the rest of the body. And sometimes they also have tumor-like swellings in the mouth, which are called epilis, and it can be very frightening for somebody to just wake up and see, tumor-like growths in their mouth. Another thing that happens is patients with hyperemesis, for example, they have a lot of acidity in their mouth, which causes, again, breakdown of tooth structure and can predispose you to gum disease and periodontal disease. So these are very important conversations to have, because the last thing you want is you're going through pregnancy, whether it's naturally or through IVF, and especially I would like to mention IVF. It's a very emotional journey for women, and you want to make sure that your health is in an optimal state so that nothing else affects your chances of getting pregnant. And oral health care is one of them.
If you enjoyed listening to Dr. Kraipak and want to learn more about fertility and pregnancy and how different diseases can affect your fertility and pregnancy, if you want to hear some success stories, please like, follow, and subscribe so you don't miss an episode. Until next time, we'll see you.
Pioneer.